the governor.
So let's speak to some involved. We're joined now by Savannah, Georgia Mayor Van Johnson and Sarasota, Florida Mayor Jen Ahearn-Koch. Thanks to both of you for coming on. And Mayor Ahearn-Koch, you have written, and I think this is important, an important thought, that local city decisions where you are will be guided by science, data, and credible public health advice. Lessening restrictions too early, especially with limited local testing, could backfire. So I'm curious, as you look at that, as you speak to the experts, what does the science, what do the experts tell you is safe, and how quickly and where to open up first?
Exactly. What we're looking at is the gating criteria, and that criteria asks for a downward trajectory of the COVID cases over a 14-day period, and we in the city of Sarasota, we're just not there yet. They also ask for robust testing, which we are working really diligently right now to get into place, but again, we still are just not there yet.
Mayor Johnson, I mean, as of last week, as I understand it, you had not been able to reach or have a conversation with Governor Brian Kemp despite multiple attempts. Have you spoken with him yet?
Not as of yet. We have not heard back from his office. We were told that they would take it under advisement, and at the point at which they decided to talk to us, they would call us. At the point at which they decided to talk to you? I mean, you have some major concerns about your city. We do. Obviously, the gubernatorial order has really made people get a false sense of security. We've experienced many more people on our streets, in our parks, on a beautiful Savannah weekend. And unfortunately, I think, we're putting ourselves in some jeopardy.
Mayor Ahearn-Koch, I know these are difficult decisions for you to make at the local level because businesses are hurting, workers are hurting, they're not making income, they're concerned about when they can go back to work, or even if they'll survive this, their businesses will survive this. Does any part of you wonder, concern that social distancing restrictions were too aggressive at any point, or do you think that you've achieved the right balance here?
Well, we as a city, we were very quick to act to issue our declaration of public health emergency, and that was on March 13th. And I think that acting quickly like that has proven a good scenario for the city of Sarasota. While we do have increasing cases on a daily basis, acting like that, I believe, because we had a number of large events planned for that weekend and the upcoming weeks, I think that helped us be in the position we are in now, which is our hospitals are not overwhelmed. And that is where you really want to be. However, as far as your economy recovering, a lot of the models and matrix show that if you want a strong and fast recovery of your economy, what you need to do is to continue the shelter in place until those numbers start to decrease over 14 days.
When we, Mayor Johnson, look at the financial stability and health of cities going forward, Senate Majority Leader Mitch McConnell made it very clear that not only does he think municipal bankruptcies are an okay route, he thinks state bankruptcies would be a good option. Granted, bankruptcy laws do not allow state bankruptcies. It's not allowed in the Constitution, so something would have to change. New York Governor Andrew Cuomo called that, quote, one of the really dumb ideas of all time. I mean, as you look at what's ahead, what would a municipal bankruptcy mean for your city?
I think it would be devastating for our city. We're trying to petition through the National League of Cities for municipalities such as Savannah, municipalities that are less than 500,000 people, to get direct assistance directly from the federal government. As of right now, they go to the top 36 cities. And Georgia does not have a city in the state that has over 500,000 people. So we're trying to get that money directly. We need to be able to take care of our folks.
Mayor Ahearn-Koch, and I know you don't have a crystal ball, no one does, but I'm sure you hear every day from constituents, residents to say, when can we expect some sense of normalcy? When you speak to the experts, what are you telling people in answer to that question?
Well, what I tell them is that the most important thing for us to think about right now is that we want to be safe, and we want our entire city and our community to be safe. And the experts, the public health experts and the medical doctors are telling us right now we need to continue to shelter in place and continue to exercise You know, the social distancing, wear masks when you're out in public, work from home if that's a possibility for you, and just continue to be safe. You know, I don't think it's that far off, but what we want to avoid with, you know, with all of our efforts is a second wave, and that second wave would be devastating for an economic recovery, and that's really what you want to avoid.
Well, listen, we know you all have such difficult decisions going forward. You got so much on your plate. We always appreciate you taking the time, and we wish the good people of both your towns the best of luck.
Thank you
so much.
Still to come this hour, growing concerns about the nation's food supply chain as the coronavirus forces some meat plants in particular